So my topic for the oral presentation is about assessment of late toxicities using patient-reported outcomes in oral cancer patients treated with surgery and adjuvant radiotherapy. So as oral cancers, they represent most common non-cutaneous malignancy of head and neck. Combined modality approach with surgery and adjuvant radiotherapy is recommended for advanced oral cancer patients. So the treatment-related toxicities, these can cause significant morbidity in these patients. So the delayed toxicities usually occurs months or years after treatment and is often permanent. So the late toxicities of radiotherapy in oral cancers, they include xerostomia, dysphagia, trismus, soft tissue fibrosis, thyroid disorders or ototoxicities. The most common delayed complication after radiation therapy and chemotherapy is xerostomia. And fibrosis can result as a result of muscle stiffening, flexion, contractures, and trismus can result because of inflammation and fibrosis of the muscles of mastication. So this has shown that the radiation-induced toxicities is one of the major cause of long-term disability after cancer treatment. So the evidence has suggested that toxicities are often underreported by physicians' assessment. So patient-reported outcomes are a useful tool to assess the late disease and treatment-related symptoms. So the aim was to assess the late toxicities using patient-reported outcomes in oral cancer patients who were treated with both surgery and adjuvant radiotherapy. So a cross-sectional study was done with study population involving patients who were treated with surgery and post-operative radiotherapy between January 2016 to June 2021. And the eligible patients were invited telephonically to participate. So 50 patients had consented and were selected for the study. So the inclusion criteria was this, patients of squamous cell carcinoma of oral cavity who had received surgery and followed by adjuvant radiotherapy with at least 6 months post-treatment regular follow-up, and those who developed recurrence during follow-up were excluded. So all the patients had been treated with adjuvant radiotherapy by intensity modulated radiotherapy with or without concurrent chemotherapy with weekly cisplatin. So the patients were then assessed for late toxicities using selected questions from NCI patient reported outcomes version of common terminology criteria for adverse events measurement system. So a selected questionnaire was drafted related to the toxicities consisting of total 9 questions, and they were translated to 2 local languages, Hindi and Telugu. These questions were then administered to patient in the native language, and they were asked to quantify their response depending upon the symptoms in last 7 days. So the responses were then analyzed by descriptive statistics. So coming over to the results, so age range of the patients were from 29 to 75 years with median age of 48 years, and a median post-treatment follow-up was around 20 months. Male to female ratio was 9:1. So site-wise distribution of these cases, 40% was seen in tongue, 24% at the alveolus, heart, palate, and involvement of the retromolar trigone, 28% at lip and buccal mucosa, and 8% at the floor of mouth. And AGCC 8th edition group staging of these patients, so 16% were in stage 2, 44% in stage 3, and 40% in stage 4. And around 48 patients had received concurrent chemotherapy with cisplatin based on the pathological risk factors, and 38% of the patient had received bilateral neck radiation. So the proportion of patients reporting the late effects, so taste changes were seen in 62% of the patients, followed by xerostomia in 60% of the patients, trismus in 48% of the patients, with jaw pain in 26% of the patients. Among this, severe stage changes were seen in 6% of the patients, and 4% had severe xerostomia. So the patients who had received concurrent chemotherapy, they reported higher xerostomia, that is around 62.5%, and 29% reported dysphagia and 50% trismus, and 33% had reported for jaw pain, compared with those who had only received adjuvant radiotherapy. And those who had received bilateral radiotherapy had reported higher proportion of dysphagia, that is 42%, 36.9% of jaw pain when compared to the unilateral radiotherapy group. And in advanced stage group, the predominant late toxicities were the taste changes, 59%, followed by xerostomia, 54.4%. So, Deboni et al. They used a patient-reported outcomes questionnaire to assess the late symptoms. So around 41 patients were there with a median follow-up 17.1 months. So they reported 58.2% with xerostomia, followed by dysphagia 14.6% and taste alteration 9.9%. Buchberg et al. Also assessed the late toxicities with 10.5% of the patients reporting dysphagia. Nilsson et al. Also used patient-reported outcomes questionnaire to assess these late toxicities, with 51.3% reporting dysphagia, 37.3% reporting xerostomia. Lan et al. Also assessed for the late toxicities using patient-reported outcomes, with dysphagia around 11% and xerostomia 4%, with space changes reported by 32% of these patients. My study limitation was that sample size was small and there was heterogeneous stage grouping of these oral cancer patients, and they were treated with different radiation doses, and there was no dosimetric correlation done between those who had xerostomia and the salivary mean dose received and taste changes and dose to the tongue received. So overall, the most prevalent late symptoms were xerostomia, taste changes, trismus, and difficulty in speech. Addition of chemotherapy or bilateral neck radiation had increased the probability to develop the late toxicities. And the use of patient-reported outcomes questionnaire ensures that the late symptoms are accurately documented and effectively addressed, and they can enable appropriate survivorship care and improve the quality of life. Thank you.